Assalamu alaikum warahmatullah. My paper for this week is outcome of single versus two visit root canal retreatment in teeth with periapical lesions, a randomized clinical trial done by a Turkish group and published in International Endodontic Journal 2022. The aim of this prospective randomized clinical trial was to evaluate the success of single visit root canal retreatment in single rooted teeth with asymptomatic periapical lesion and compare the results with the control group retreated in two visits. For the materials and method, this randomized clinical trial, it's a prospective, parallel designed, single blinded and single centered study. For the inclusion criteria, patient who's approved to participate in this study with non-contributory medical history, mature single-rooted teeth that had root canal treatment at least 4 years ago, had a periapical lesion whose largest initial diameters range between 2 and 10 millimeter on the preoperative digital radiographs, which were scored as PAI more than or equal to 3 using a periapical index scale, and diagnosed as asymptomatic apical periodontitis and were suitable for rubber dam isolation. The exclusion criteria were younger than 18 years of age, having taken any analgesic, antibiotics or corticosteroid 2 weeks before the root canal retreatment, teeth with the periodontal attachment loss, vertical root fracture, external resorption, perforation, broken instrument and non-restorable tooth. They have 100 previously root canal treated single rooted teeth with asymptomatic apical periodontitis included in this study, and the teeth were randomly allocated to two groups, either single visit or two visit, by using the automatic randomization method. The treatment procedure was done by experienced endodontist and were done using a step back technique and obturated with the lateral condensation technique. They use a gutta-percha and H+ sealer, and the follow-up was they followed up after 6, 12 and 24 months. Also they used clinically and radiographic examination in all the visits. They modified the PA scoring system. They used an radiographic healing criteria as healed, healing and not healed. For the results, 89 teeth could be examined at 24 months, and the recall rate was 89%. 63 were maxillary anterior teeth and 26 were mandibular premolars. In the single visit group, 88.6 were classified as healed, 6.8 as classified as healing, 4.5 classified as failure, while in two visits showing 86.7% as healed, 4.4 as healing and 8.9 as failure. The effect of preoperative factors on the outcome of a root canal retreatment. In a teeth with the larger periapical lesions, the success rate was significantly lower than the teeth with the small lesions. The success rate of the root canal filling materials was lower than that of short and adequate primary root canal fillings. They concluded at the end that within the limitations of the present study, A similar success rate were observed between a single visit and two visits for root canal retreatment for asymptomatic teeth with preapical lesions. The size of a preapical lesion and initial apical level of root canal filling affected the outcome of a root canal retreatment. The limitations of this study was the sample size that they have. Also, that there is a limitations the techniques that they use, the step back technique. They use hand files instead of rotary files in root canal preparation. And that's it. Thank you so much for listening.